name is Jennafer Walker, and I'm doing my persuasive speech for Miss Nicole Harmon's class at Northeast Mississippi Community College. What I want you to do, first of all, as we get started, is I want you to think of your favorite superhero. Go ahead, get them in your mind. I want you to think of the best one that you could possibly come up with. Maybe it's Superman, maybe it's Iron Man. For some of you ladies, maybe it's Wonder Woman, maybe it's Supergirl. Now you've got that superhero in your mind. What do superheroes do? They save lives. They take care of people. They're always there when you need them. That's what I want to talk to you about today. Did you know that you have the genetic ability to be a superhero? You do. It's in your genes. It's called being an organ donor. Being an organ donor is kind of like being a superhero, and that's what I want to go over with you today, is about how you being an organ donor, like very many superheroes, can actually save lives. According to CQ researcher, the Mayo Clinic, and WebMD, more than 110,000 Americans are currently on waiting lists for kidneys, lungs, hearts, and other donatable organs. 80% of these need kidneys. Now, part of that is because, like most people know, in the U.S., we have obesity, lots of diabetes, and a lot of hypertension as well. WebMD also states that 6,500 people a year, that's about 18 people a day, will die before they receive their transplant that they are needing. Organ donors are in very short supply. We actually have more people that need an organ than people that are willing to give one. Now, there's two different types of organ donors. The first one I'd like to talk to you about is the living donor. Okay? A lot of people have questions. Who can donate? Okay? Anyone can donate that's over 18 years of age or older. Anybody that's younger than that has to have parental consent. Another question that some people will have is, will I be paid to donate my organ? The answer is no. Being paid for organs is considered a black market, and it's also illegal. However, all of your expenses are paid. Your hospital stay, the surgical procedure, everything would be covered by the patient needing the organ or by the insurance company that they use. A lot of people also ask, is there health risk involved? And the question can be yes, but not necessarily. Usually things may happen later on down the line. You may become someone who needs a transplant eventually if you were willing to give one up for someone else. Most of the time your body is able to adjust with half or missing whole of that organ. The other type of donor is the deceased donor. And this is the one that a lot of people are a little afraid of. They have a lot more questions. A lot of people are scared to sign the part of their driver's license that has to do with being a deceased owner. They're afraid that the quality of care that they will receive at a hospital in a life-threatening situation won't be quite as good as if they weren't an organ donor. This isn't true. The surgical team that is there to take care of you in a life-threatening situation is nowhere near the team that would come in and actually take and harvest your organs to take them to save someone else's life. Another thing that people are afraid of is, will I be able to have an open casket after donating an organ? And the answer is yes. Where they take your organs and how that they do that is by no way going to hurt the fact of your loved ones being able to see you before it's time for you to go. The best and easy in knowing is that there are cons to every pro. Some of the major cons is that there's major surgery, all sorts of risks, bleeding, infection, and there's a lot more possibilities of you needing something later on down the road. The pros is the greatest benefit to being an organ donor is knowing that you are saving a life. That life could be a spouse, your children, your parents, your siblings. It could be a very special friend, or it could be a very grateful stranger. So what I'm asking you to do today is be a superhero, and let's save lives.